everyone, my name is Amber Jurgensmeyer. Today I would like to discuss a surgery called spinal fusion. Does anyone out there know what scoliosis is or know someone who has had this surgery performed on them? I do. I had spinal fusion surgery for my severe scoliosis in June of 2006. This surgery was both scary and life-saving for me. I was 14 years old and getting ready to enter my freshman year of high school when my doctor told me that my scoliosis had reached a critical point, and if I didn't have spinal fusion, I had a 95% chance of being in a wheelchair by the end of my teenage years. The chances of spending my life in a wheelchair somewhat outweighed my extreme fear of having the operation. During this speech, I will explain briefly what scoliosis is, the reason for having spinal fusion surgery performed, the two different types of spinal curves, and the recovery process after spinal fusion has been performed. According to the Mayo Clinic's webpage, their definition of scoliosis is a sideways curvature of the spine that occurs most often in the growth spurt just before puberty. They also say that the cause of this disease is primarily unknown. Now that we know what scoliosis is, we can move on to why spinal fusion is performed. According to Dr. Robert Keller, an orthopedic specialist who works with publishing articles on WebMD.com, spinal fusion is surgery that is done to join or fuse two or more vertebrae. Spinal fusion is an attempt to straighten out the spinal curvature. Normally, the surgery is done with metal implants. In my specific case, I have two titanium rods that are on either side of my spine and are held together using 16-volt type devices that go through my spine. My incision was made from the bottom of my neck to the top of my tailbone. This type of surgery is pretty intense and can take anywhere from 6 to 12 hours to perform, depending upon what type and how severe your curvature is. They measure spinal curves in degrees using high-technology x-rays. The next thing I would like to talk about is the different types of spinal curvatures involved with scoliosis. There are both single and double curvatures. A single curve resembles the letter C, and the double curve resembles the letter S. And like I had mentioned, they measure the degree of these curvatures and use that as the basis for the decision on treatment and how often you see your orthopedic specialist. Not all scoliosis patients need or are candidates for the spinal fusion procedure. The initial way that I found out that I might have scoliosis was during a 7th grade school health screening. The school nurse sent home a health referral for me to see my primary physician to get a scoliosis screening done by her. Sure enough, after seeing my primary care doctor, she said that I had a double curvature that was 20 degrees on the top and 35 degrees on the bottom, and she was referring me to an orthopedic specialist in Springfield, Missouri. The doctor's name was Dr. William Goodman, and he seemed like an extremely well-educated person, physician, and surgeon. And unlike some doctors, he spoke to me like a person and used words that I could understand. He told me that for now we were just going to keep an eye on my back, and so long as my curvature didn't increase as my height did, I would probably be alright without any serious form of treatment. This news pleased me, and I wasn't too worried about my appointment in 3 months. Of course, during this time period, I took the what-ifs into my own hands and did the internet research thing and tried to figure out what he would do if my curves had worsened. According to all the medical websites that I could find, they all stated that the first line of treatment for trying to straighten out curvatures was this horrible piece of extremely uncomfortable plastic that you were supposed to wear between 20 and 23 hours per day. This is when I began to pray that my curve wouldn't change. Soon enough, the 3 months passed and I was back in the same doctor's office, waiting to see what he had to say. My top curve had increased to 45 degrees, and my bottom curve had increased to 55 degrees. This was not at all what I wanted to hear. He started discussing with me that he was going to have me fitted for a back brace that would be worn underneath my clothing. He didn't sugarcoat anything, which is something else that I liked about his conversations. He was as honest as he could be, and he told me that it wouldn't be comfortable, I would probably experience pressure sores from it, and would have trouble sleeping at night, and that I could only take it off for showering in short 5 to 10 minute breaks for up to 2 hours throughout the day. This definitely depressed me, to say the least. Being in junior high and having to wear this hideous plastic thing to school was not what I wanted to do. But he also told me that if the brace didn't improve or stabilize my curve, that surgery was likely the next step. This brings me to say that regardless of knowing this information, I was a non-compliant patient who only wore the brace when I felt like it. I definitely wouldn't wear the brace at night because after about 2 weeks of absolutely no sleep, I was done with it. I gave up caring whether the curve got better or worse, despite all of the family and friends I had supporting me through all of it. Needless to say, when I went back to see Dr. Goodman 6 months later, my curves had reached even larger numbers, with my top curve at 68 and my bottom went in at 80. He said that surgery was pretty much the only option that I had now. Talk about a lot of regrets at this point. I was extremely mad at myself for not wearing this obnoxious brace. He told me that this surgery would be to fix both curves, and therefore my incision would have to be the length of my entire back, whereas single curve patients can sometimes get away with a partial back incision. He scheduled my surgery for 6 weeks from that day, which seemed like an eternity away when it gave me 42 days to think about all the things that could go wrong with the operation. As scared as I was of those things, that 95% chance of becoming wheelchair bound if I didn't do it boosted me to be okay with having surgery. My surgery was an 8.5-hour procedure with a long recovery afterwards. This brings me to my last topic of the recovery process. Initially, after surgery, you're in the hospital for 5 to 7 days, granted that the surgery goes as planned and there's no infection at the incision site. After that, you will pretty much be miserable for 8 to 10 weeks, and it will hurt every time you move, and you won't be comfortable no matter what position you are in. Then came the fun part, the news about all the restrictions that I had for the next year. I was fixing to start my freshman year of high school in the fall, and had full intentions of trying out cheerleading, playing softball, and pretty much doing any activity that I wanted. Boy, was I wrong. He told me that I needed to limit my lifting to about 25 pounds. I shouldn't do any activity that shouldn't jar my back, and I definitely couldn't be throwing people in the air, doing herkies, and sliding into home plate. However, after that year, I had all restrictions lifted, and the only instructions that I received were that if I were in a car accident, four-wheeler wreck, or some type of activity where my back could have been damaged, I need to immediately be seen in an emergency room. As it goes, the recovery process isn't short and sweet, but the long-term outcome is well worth it. As you see, I am almost 21 years old and standing here today. In conclusion, I hope that everyone learned a little bit about scoliosis and spinal fusion, and they now know the reason spinal fusion is performed, the types of spinal curvatures, and the recovery process after surgery. Thank you all for listening.